My name is Dr. Jamie. I want to start off with our evaluation process. One of the biggest things we use, the Insight Subluxation Station, that's something we went over with all you guys. You guys got your core score. It went into some detail about how your nervous system is really working. That's some of the newest technology that there is out there. Also, the physical examination, x-rays, we went over your guys' x-rays with you. You know, that's something that really lets us see, okay, here's where maybe your complaint is. What else is going on in your spine that could maybe be a contributing factor to some of the complaints that you guys have. Foot scans, posture evaluations, all these things can certainly identify hidden subluxations. Now, what's a hidden subluxation? That's a subluxation that you have that maybe isn't causing symptoms yet, okay? We all know what a symptom is, okay? You start feeling, oh, I feel the pain, okay? But so often that subluxation is there for an extended period of time and your body tries to cope with it before your body kind of waves the proverbial white flag to say, okay, fire pain receptors here, right? So, now, posture evaluation. This is something where you guys have your clipboards there. And you should have a half sheet of paper there that has what kind of looks like a spine on there. And that's basically the do-it-yourself at home posture evaluation kit. You can sit there with a family member, kids, whoever, and be there, okay, kind of sketch that out like we did with you guys, except for we had pictures and it was all digital. But basically looking at things like somebody's head that's out forward, if you see that poster there, damaging effects of forward head posture, it's the old, your head starts going out forward, it's not sitting on your spine the way it's supposed to. And basically gravity starts pulling, And who do you think wins, gravity or you?
Gravity.
Gravity, yeah. Gravity has a pretty good win percentage, okay? So, but forward head, rounded shoulders, kind of that sway back or flat back, all those things can indicate subluxation. Going a little deeper, head tilt, uneven shoulders, uneven hips, knee rotation, foot flare, definitely indicates subluxation. That's something too where if you're ever out at like the mall or in an airport, you see people walking around. It's just something I do unconsciously now. I see people, and I'm like, oh my gosh, that guy needs to go see a chiropractor, or I got my wife trained too. Every now and then she'll elbow me and be like, holy cow, look at that guy's head, and it's like all forward like this. So,
what is the knee rotation when it was that it won't rotate?
No, when that knee rotation, some people are kind of knock-kneed.
Right.
Okay, it's not because your knee bends inward when it's not supposed to. Okay. It's because your thigh gets rotated up in the pelvis.
Okay.
Okay. Now that could be a function of maybe you have an excessively tight musculature in the front of the thigh that's causing it to rotate. It could be that your pelvis is uneven. Okay. There could be any number of reasons for that, but the main thing is, what we look at as chiropractors, we look at, okay, that pelvis is off a little bit, and that's causing that leg to be off. It's the same thing when we adjusted you for your first time. We showed how your legs were different lengths. And unless you tell me that you broke your femur right above the knee when you were like 10 years old, okay, your feet are the same length. Or I'm sorry, your feet are the same length. Your legs are the same length. It's more, where's that difference in the pelvis and low back that causes that? Now, going forward, we have three kinds of care here in the office: initial intensive care, restorative care, and optimal wellness care. Our job as doctors is pretty easy. Again, I'm here all day, Monday, Tuesday, Wednesday, Friday, and I don't really leave, and I see patients all day, okay? Now, why is my job easy and your job hard? Because if you have to choose between, say, driving to our office, maybe you wait 10, 15 minutes to see a doctor, you get adjusted, you drive back home, etc. You have that choice versus getting up from your couch and going to your medicine cabinet and getting an Advil. Okay? What's easier?
Well, getting the Advil.
Getting the Advil. What's less expensive?
The Advil.
Getting the Advil, okay? But how much does the Advil fix?
Nothing.
No, it doesn't fix a thing. It makes you feel a little better, okay? But the story I always use for that is if you have kids and you say, hey, go clean your room, they have a sloppy room, and they just pull the sheets off the bed and cover the floor with the sheets. Okay, you don't see the mess anymore, but the mess is still there, right?
Right.
So that's basically what an Advil does. What is difficult is because, number one, you have to make the trip in here. We adjust you, but we're actually fixing the problem. Okay, and it takes a conscious decision and a real conscious effort on your part because it's easy. Our society today, we're so ingrained to just like give me the quick fix. I don't want to go exercise. I want liposuction. Stuff like that. I don't want to get into shape. I just want to look good. And it's like, okay, well, you start fixing things, and then It makes it easier to get into shape, et cetera, et cetera. So,
Quick fix is never good.
what's that?
Quick fix is never good.
No, it's the old, like, if it's too good to be true, it's probably too good to be true. So basically, your road to health and wellness. First stage of care here in the office is initial intensive care. Basically, when we're doing that, we're finding and adjusting subluxations, and we're starting to really fix things up. Now, that's early on in care. That's where you guys are both at now, okay? And what we're doing is we're adjusting, and it lets your body start to heal. And a cool side effect is you start to feel better, okay? That's what I always say. What's the side effect of chiropractic? Your pain goes away. Exactly. Whereas, I'm probably going to go home tonight. This is a Monday. I'm going to go home. I'm going to turn on Monday Night Football, and there'll probably be 2 or 3 drug commercials on there. Those drug commercials are always 60 to 90 seconds, okay? If you see one, time it. If it's a 60-second commercial, 35 to 45 seconds will be side effects.
Side effects, yeah.
Yeah. And the side effects isn't that your pain goes away.
In a magazine the other day I was reading, and there was some drug, I don't even know what it was, but there was 3 full pages of side effects, and I thought, oh, come on.
Yeah, I mean, in some of this stuff, it's an antidepressant drug, but a side effect is suicidal thoughts. And it's like, dude, what am I taking this thing for? I mean, great, my antidepressant drug is making me more depressed. So, now, and again, right here, byproduct of this initial adjustment, if you came in with pain, starts to subside in most cases. I wish I could say 100% of patients get better with chiropractic. I can't, that's not the case. Most of the patients we see, though, start to see big improvements, though. And why wouldn't you want this patch care or the initial intensive care only? Because your symptoms start to be relieved, okay? But the cause continues, all right? It's the old, if I have a hose that's kinked, okay, the hose is your nerve, and that's kinked up, all right? And there's water trying to go through it. If I unkink the hose a little bit, hey, some water starts to flow through. I can water my plants a little bit. But guess what? It's still kinked, okay? It's not unkinked all the way. That's the same thing. We start to adjust. Things start feeling better. Things start going better. And you're like, dude, sweet, this is nice. And yeah, I agree. It's pretty cool. I mean, you're pain-free. We're good here, right? But we haven't really fixed it yet, okay? What's the last thing that happens when you've been subluxated for a long time? Pain starts to happen. What's the first thing that goes away when you've been subluxated for a long time? Pain goes away. Exactly. So, moving on, restorative care. What causes your body to re-subluxate? Basically, long-term muscle memory, number 1, and life stresses. We're talking about long-term muscle memory, all right? What I tell all my patients, if you're right-handed, okay, go home and try to write your name with your left, okay? Your nervous system is sending the signals down that arm, but your left hand isn't used to doing it. And I can write my name, but it looks like a 3-year-old scrawled it out, okay? Because I'm not used to writing with my left hand. And that's the same thing. Your muscles around your spine, they have memory, okay? They're used to holding your spine in a certain position because that's the way your body's adapted to make it work, all right? Now, every time we adjust, we put your bones back into a different place. And your nervous system says, dude, this is cool. And your muscles are like, hold on, I gotta study this a little bit. And then they kind of forget, and then we adjust you again. And then each time, they get a little bit better, okay? And life stresses, you're not gonna stop doing the things you do every day, okay? Nobody lives in an anti-gravity bubble. Then it's retrain and rehab muscles, massage therapy, stretching muscles that hold the spine and vertebra, strengthening muscles that hold the spine and vertebra, and spinal remolding. Popular. And then we also have some basically remodeling blocks that help to restore some of the curvatures in the spine. And this is not the best example because this spine has been beat up, okay? But if you're a new patient in our office, 2 things we see a lot. Instead of a nice curve in the neck, that thing's going straight, okay? And then same thing in the low back. Instead of having a nice curve, it's straightened out too. What the blocks do is it's something you lay on at home, and it just helps to put a correct curvature in the low back and a correct curvature in the neck, okay? Curvatures start getting replaced. What starts happening? Things start working better. Exactly. You start feeling better, and why are you feeling better?
Because you're in line.
Exactly. You're working better. You restore the proper function, and the proper feeling just can't help but follow afterwards. Now, lastly, optimal wellness care. That's the 3rd phase of care here in the office. Now, this is where we've gotten through your initial like, how this hurts, and guess what? We've done a lot of the retraining work of the muscles around your spine and your spine to hold the adjustments better and more consistently. And people that are in the optimum wellness care phase, I've seen about every 2 weeks. Okay, I'm adjusting them pretty regularly. We've got patients in this office that have been coming in for 6-7 years. Now, why would you want to be adjusted regularly? Remove hidden subluxations. We talked about those. Those are the subluxations that are present, but they're not causing a problem yet. Reduce the effects of stress, keep your nervous system healthy, keeps you healthy, and your frequency depends on your subluxations and your lifestyle. And again, most of my patients in optimal wellness care I see every 2 weeks. And out of everybody I adjust every day, 10 to 20 people, you guys know how to sign into the computer up front. 10 to 20 people that just I adjust every day. They put down that they don't have any complaints today. Okay? So why are they here? Why are they getting adjusted?
Why not?
Well, okay,
Why not?
that's one answer, but the thing is, they know and they understand that how do you live your life? You live it through your nervous system. Okay? If you don't have a nervous system, you don't see, you can't hear, you can't smell, you can't taste, you can't touch. And that's not a fun life. All right? And also, when you're well adjusted, your nervous system works better. You just have decreased levels of pain. My patients that I've been seeing for 5-6 months, they come in and they're just like, man, I can just feel. If I go like 3.5-4 weeks, if I miss an adjustment, I can feel it. Because I'm so used to being adjusted all the time, and I'm so used to being in that correct position, in that correct alignment, that if I don't stay that way, my body lets me know. Okay? That's why it's about health. It's really about health. I mean, chiropractic, yeah, I want you guys' pain to go away. I really do, because pain sucks. All right, I get that. But chiropractic is really about function, and we just adjust where it needs to be adjusted. And guess what? You got this big, beautiful brain up in your head. It knows how to fix you. You just got to get rid of the roadblocks in the way of it. So, lastly, healthy by choice, not by chance. That's kind of one of the mottos and sayings we have in the office here. So many times, I hear patients say, oh, well, my parents were overweight, so I'm going to be overweight. Or my mom and dad had high blood pressure, so I had high blood pressure, or diabetes, or whatever. Well, guess what those are? Those are all lifestyle diseases, okay? Now, what do we pick up from our parents besides their genes? If you look at a family picture of mine, you're going to say, oh my gosh, Dr. Jamie, you and your sister are obviously your parents' kids. We all look alike. That's what I get from my parents. I'm tall, my dad is tall, okay? But you also get your lifestyle from your parents, okay? Your habits. If you're a kid growing up, and if my dad would have come home every single night and sat on the couch and ate a bunch of potato chips and watched TV and had a few beers, guess what I would think would be normal? Sitting on the couch, having a bunch of potato chips and having a few beers. And guess what? I wouldn't be very healthy. All right? That's what we inherit from our parents. That's why maybe your parents had high blood pressure. Okay, you also inherit diet, exercise habits, lifestyle, basically just trends of the way you're going to live your life from your parents. That's why we see so many families with basically generational diabetes almost, because they don't know there's another way.
Right.
And that's why healthy by choice, okay, it's not chance. There are very few diseases that are truly hereditary. All right? If you have like Huntington's chorea, okay, sorry man, that's hereditary. But high blood pressure is not. Heart disease is not. The tendencies can be because we learned how to live from our parents, okay? And that's where one of the other things in the office we really try to emphasize, getting adjusted is important. So is diet, exercise, rest, etc. Okay? Lastly, just want to close up with this slide here. These are the 4 practicing doctors in the office. You've met 3 of us here tonight, myself, Dr. Mark, Dr. Amber. This is Dr. Lynn, she's Dr. Mark's wife. They started the clinic about 7 years ago, and she does nutritional consultation, supplementation consultation here in the office. If any of you guys have any questions about, I really want to check out maybe a different kind of diet, I've been struggling with this. She has a real passion for that and a real gift for that. She'd love to sit down with you guys and go over that with you.
Okay.
So I'd like to finish up thanking you guys for your time here tonight. That's all we have for this evening. If you guys have any questions, you can go ahead and I can answer those now, or otherwise we can call it a night. All right?